Hi, everyone. My name is Elizabeth Volkmann, and I'm a rheumatologist at UCLA in Los Angeles. And I'm really sorry I couldn't be there in person with you today, but I recently gave birth to a baby who's sitting on my lap right now. And it was too soon to take him on the plane, but I was so thrilled that the Scleroderma Foundation asked me to still give this talk to you because this topic I feel very passionate about, and I'm happy to share some of my insights with you to help empower you on your journey with nutrition and improving your gut health. So we're going to get started. There's a lot of information to cover, and I want to make sure that we also have an adequate amount of time at the end for questions. So the objectives of the talk today are to, first of all, describe gastrointestinal symptoms and systemic sclerosis. And many of you are already experts in this area, having your own personal experiences, but some of you may be unfamiliar with some of the symptoms that can occur. And it's always good to know about the symptoms that can happen, even if you don't have them yet. So if they do happen, you can be prepared for what you can do to help manage them. We'll also talk about the role of the gut microbiome in systemic sclerosis, specifically as it relates to nutrition and GI symptoms. And then finally, I want to give you some strategies for rebalancing your own gut microbiome with the focus again on nutrition. So there's a lot of different manifestations or symptoms of GI disease and scleroderma. And we like to say that this starts in the mouth and it actually goes all the way down to the anus. So in a patient with systemic sclerosis, you can have problems like dysphagia, which is a medical term for difficulty swallowing. You can have GERD or acid reflux. You can have issues with the stomach leading to early satiety, which could cause abdominal pain or even vomiting, nausea. You can get bleeding problems and anemia. We're going to go through each of these things, but I like to show this picture because I think it helps visualize where these problems can occur and why the symptoms develop. So most patients with systemic sclerosis will get GI involvement over the course of their disease, and it can affect both the upper tract, which would be anything from the mouth all the way down to the stomach, and then the lower involvement can be the small intestine, large intestine, and rectum. And it can happen even early in the disease, and both of these tend to progress over time, largely because we don't have good treatments for them yet. There's now even evidence that patients who have very early scleroderma can have GI symptoms. So these are patients in studies who don't even definitely meet criteria for systemic sclerosis, but they may just have Raynaud's, abnormal nail fold capillaries, and they may have an autoantibody for scleroderma. Even these patients can have GI disease. And there was a study done recently in Italy where they looked at about 50 patients, about half had very early scleroderma and then half had definite scleroderma. And there was actually no difference in the severity of GI symptoms between the two groups. And both groups had reflux, malnutrition, diarrhea, constipation, SIBO. So I mention this because if you're living with scleroderma and you were recently diagnosed, you may already be having some of these symptoms, or may have had them for years. And in fact, in my practice, I find that if I really probe patients about their experience with their GI tract, many people will tell me that even 5 years, sometimes 10 years before they were diagnosed with scleroderma, they started to notice some heartburn, some bloating, even some constipation. And some patients are even misdiagnosed as having irritable bowel syndrome, when in fact, these symptoms are due to early systemic sclerosis. And then even so, and this often breaks my heart when people tell me that they went to their doctor complaining of GI symptoms and they were told that these symptoms were all in their head, and they're not in your head, they're in your GI tract, and they're very real manifestations of this disease. So we're going to go through some of the ways that your GI tract can be affected. So many of you may have experienced difficulty with opening your mouth. This doesn't happen for every patient with scleroderma, but you can imagine that if you have difficulty opening your mouth, it can make it more difficult to even chew your food. Many patients will have decreased salivary flow, meaning they won't produce as much saliva, and that saliva actually helps break down the food in the mouth to help it be easier for you to swallow and also digest. There can be blood vessel changes that happen in the mouth that make you more sensitive to temperature and also cause some bleeding. And then as the disease evolves, there can be tooth resorption. And there's some excellent sessions at this meeting today going on about dental care and scleroderma, which is so, so important. So again, the signs and symptoms of mouth involvement could be difficulty chewing, dry mouth, cavities, which can happen when you don't have a good amount of saliva, temperature sensitivity, and then even your nutrition can be compromised if you're not able to eat well due to these changes in the mouth. What about the esophagus? This affects most patients with scleroderma where there are problems with motility. So all along your GI tract, you have muscles that actually contract in this very organized, rhythmical way to push the food down. But what can happen is that there can be ineffective motility or no motility, meaning that it becomes very difficult for food to pass down the esophagus. And this can lead to choking, the feeling like something is stuck in your throat. In addition, the lower part of the esophagus that connects to the stomach has a sphincter, and it will stay closed unless you eat, and then it opens so the food can pass from the esophagus to the stomach. But in scleroderma, that sphincter becomes very relaxed and it becomes open all of the time. So you can imagine that if you're sitting upright, gravity will help keep the food in the stomach. But the moment you lie back with that sphincter open, the food or liquids in your stomach can pass back up into the esophagus. There can be changes in blood vessels, and then really serious complications can occur when there's a narrowing of the esophagus. We call this a stricture. And then this is when nothing can pass. So if you have a lot of vomiting or difficulty swallowing your own saliva even, you may have a stricture. And another symptom that can happen that sometimes people confuse with lung disease is you can get a chronic cough just from reflux disease, and it can be a dry or a wet cough, meaning it might produce saliva or mucus or not. And I think this is important to keep in mind because I have some patients who have lung disease where it's under great control, but they still have a cough. And then we think, okay, maybe this cough isn't coming from the lungs. It might be coming from the GI tract, and we might need to do a better job of managing GI symptoms. Another serious complication that can happen is that the stomach can actually have pretty severe blood vessel changes. And in this panel here, panel B is something called watermelon stomach or GAVE. This can happen anytime over the course of scleroderma. And this can cause profound bleeding. And sometimes you may not notice the bleeding because when bleeding happens in the upper GI tract, your body starts to kind of digest the blood as you go down. So you might not see bright red blood in your stool. It might look just darker in color, or you may not even notice a difference in color. But what your doctor should be checking for is anemia. So if you start to develop anemia, they need to make sure that you're not having any kind of blood loss in your GI tract. Also with the stomach, you can get delayed gastric emptying. So whatever is in the stomach has to then, pass into the intestines to undergo more digestion. And if that process is delayed, the stomach can get full very easily. And some of you may experience this where, you would eat half a meal and already feel full when before you could eat a full meal and not have that sensation. And we're going to go through again strategies to help manage these symptoms. The lower GI signs and symptoms are pretty tricky, and they're tricky in the sense that they can cause a lot of overlapping symptoms. So I would say that if your small intestine is involved, you can have something called pseudo-obstruction, where the intestine starts to twist a little on itself, and this can make it very difficult to even pass gas, let alone have a bowel movement. You can get bacterial overgrowth, which is an overabundance of bacteria that can produce more gas and cause bloating for you, and even block your ability to properly absorb food because the bacteria in your gut are actually there to help you digest your food. And if you have an overabundance of these quote unquote bad bacteria, you're not going to be able to digest the food as well. The large intestine can also undergo pseudo-obstruction or twisting, causing constipation or blockages. And then dysmotility is common, just like we talked about in the esophagus. Sometimes the motility is slowed down a lot, and that can cause constipation, bloating. For some patients, it's actually faster and they get diarrhea. And then the rectum is involved with most patients. And I realize that this can sometimes be an uncomfortable thing to speak about with your doctors, and they might not even think to ask you about it. But when you have problems with your rectum, there can be weakness of the muscles there or dysmotility that can lead to fecal incontinence. So again, the signs and symptoms when all of these things are affected can overlap, making it sometimes tricky to figure out what's driving the symptom. But if you have weight loss, distension, bloating, constipation, diarrhea, abdominal pain, fecal incontinence, your doctor should be looking at your lower GI tract too to try to figure out where the problem is coming from and try to address it. Part of the reason we don't have good treatments yet for GI disease and scleroderma is that the pathology, what drives the disease, is somewhat complex. So it's not so simple that it's just related to scarring in the GI tract or fibrosis or inflammation. There's clearly a vasculopathy. So what that means is that there's changes in your blood vessels that are preventing the flow of blood to the GI tract. So most of you are familiar with Raynaud's disease, when you don't get enough blood flow to your hands and feet. But this same kind of process can happen with the GI tract. And this is why a simple thing like making sure you're warm when you eat can actually make a difference in terms of your digestion. The autonomic nervous system is also probably involved. And this is the system that controls your digestion. And you want to be in a parasympathetic state when you digest your food. And some patients with autoimmune disease, including systemic sclerosis, can get dysfunction of this system. And so a sign of this would be if you've ever been told that you have POTS syndrome, or if you ever feel like when you stand up, you always get lightheaded, and instead of your heart rate and blood pressure going up to support blood flow to your brain, it actually goes down. So the opposite happens. So this kind of dysfunction can happen in the GI tract because you have a whole nervous system in that system. Inflammation and autoimmunity can happen. And some of the early studies that were done looking at specimens of people's intestines after they had passed showed that even the muscles are actually atrophied or non-existent. And so that's another reason why you can't push the food down properly if you don't have the muscles there. But an area that I've been interested in for a long time, if any of you have heard my talks before, is the gut microbiome, because there's now evidence that the microbiome can actually affect all of these different systems. And this is a kind of complicated figure that I don't want to waste too much time on, but just to show you that when you have an imbalance in your gut bacteria, and we call this intestinal dysbiosis, it can interact with all parts of the immune system. It can interact with, the blood vessel changes. So it could potentially be one of the root causes of these problems. And again, this is why I'm so interested in trying to figure this problem out for patients, because we might be able to improve the microbiome function and then have it affect all of these processes in a really beneficial way. And I was, interested in this from the time I was a fellow training to be a rheumatologist at UCLA, where we conducted the first study to look at the gut microbiome in patients with systemic sclerosis. And we had our patients undergo colonoscopies, and then we sampled some fluid from two parts of their colon, the cecum and sigmoid colon. And then we compared the samples to patients who didn't have scleroderma or any other autoimmune disease. And what this figure is showing you is how the samples separate out in space based on their overall composition of the microbiome. So each open circle in this, this box you see here represents an individual patient with scleroderma, and each closed circle represents a healthy control. And this figure helps visualize how they separate out. And you can see that the darker samples kind of cluster together and the open samples cluster together. And this was true for both the cecum and sigmoid. So even with a relatively small sample size, we had about 17 patients in each group, it was very clear that there was a significant difference between these populations explained by the presence or absence of scleroderma. So we went a step further and we wanted to know which bacteria were different in these patients. So we looked at genus level differences, and this was because we were using technology at that time that only allowed us to see down to that level. And you can see here on the right, the green bars represent those bacteria, the genera that were more abundant in the patient with scleroderma. And on the red on the left, these were the patients that were less abundant. And so there are important ones to notice. If you see on the top here, and I don't know if you can see my arrow, but this one here and ruminococcus, these are all considered bacteria that we think promote inflammation and disease, and they were more abundant in the scleroderma patients. Whereas if you look on the red here, things like Faecalibacterium, Clostridium, we consider these to be commensal genera that we think protect against inflammation. So clearly there was an imbalance in these patients. But when I started doing this research, I met some criticism by other scientists in my field, which is great. This is how science evolves, is when we question why we're seeing things, and people ask, well, what if the medication the patient is taking is causing these changes? Or what if, they're changing their diet in some negative way? And that's a really good point. So we've gone further and we've looked at patients with very early scleroderma. And I have a wonderful collaborator in Sweden, Christopher Andresen. And we were able to get samples from his cohort of patients who had just been diagnosed with scleroderma. So they were only about 2 years into having the disease. Most of them didn't have any GI symptoms. They weren't even taking medications to affect their immune system. And we compared this group of patients again to healthy controls without scleroderma. And we again saw these differences in bacterial genera. So the ones to the right of that vertical line were more abundant in the patients with scleroderma, and the ones to the left were less abundant. And so again, this gives us more evidence that these changes in the microbiome are occurring early on for patients. And then we've even gone a step further to see, could specific species be associated with having more or less symptoms? So this was a presentation we gave last year at the ACR meeting, which is our big rheumatology conference that we have every year. It's the largest one in the world. And what we found is that when we looked at the severity of GI symptoms, we looked at it using a questionnaire called the UCLA GIT 2.0. So this is on the horizontal axis here. The higher the score was associated with certain bacterial species. So for example, this bacterial on the left was actually protective against symptoms. So when patients had more of this bacteria, they actually had a lower amount of symptoms. Whereas the one on the right, they actually, as that abundance of that species went up, they had more symptoms. And what was unique about this analysis is that we tried to adjust for things that also affect GI symptoms and species. So we adjusted to make sure we accounted for BMI, the patient's sex, whether they were on immune suppression, whether they were taking probiotics or PPIs. So we tried to do a good analysis to really see, is there a connection between certain species and symptoms? And as we validate this research, we could use this to develop a personalized probiotic. So we'd be able to design a probiotic just for patients with scleroderma that would help replenish some of these bacteria that we think could help prevent their GI symptoms. So how do we treat this disease? I think you're all here today to learn information about how you can better manage your scleroderma and feel and function better during your day. So, traditionally, the way people have approached treating GI disease has been really to just target symptoms. So if you have acid reflux, you're given medications to suppress your acid. If you have constipation, you're giving laxatives and promotility agents. If you have diarrhea, you're given medications to block diarrhea. The problem with this approach is that it doesn't address the root cause of the dysfunction. So it's kind of like just keep putting a Band-Aid on the same wound without figuring out what is causing the wound in you. And I think, one analogy I like to share with my patients and the doctors who I train is that, imagine for your lung disease, if no one ever gave you medications like mycophenolate and nintedanib and rituximab, medications that we know prevent the progression of that disease, and they only just gave you a cough suppressant or they just put you on oxygen. So, really with GI disease, unfortunately, the way patients have traditionally have been treated, it does help their symptoms, but it doesn't get at the root cause of the dysfunction. And I'm the type of doctor that when I work with patients, I really like to understand why someone is experiencing what they are so I can prevent it from getting worse. The other thing is that, I mentioned to you early in the talk that these symptoms arise very early, sometimes before you even get diagnosed with scleroderma, but oftentimes doctors will only introduce therapies after the symptoms become so bothersome that they're affecting your quality of life. So if no doctor has ever asked you about, do you have constipation or fecal incontinence, you might not even tell them that until it's pretty severe, because we usually experience symptoms in our GI tract, and sometimes we think it's our own fault because of what we ate or because of the stress we were under, and really, if you're having any kind of symptoms there, sometimes you really need to advocate for yourself, especially if your doctor isn't asking you about these symptoms. Another thing that we're limited by as doctors is that we don't have great objective ways to monitor the progression of the GI disease. So if you live with lung disease from scleroderma, you know that you need to go for your pulmonary function testing and your CT scans, and the doctors use this information to judge whether your treatments are working, in addition to asking you how you feel. But we really don't have those same types of metrics with GI. We can do endoscopy, we can do some manometry, but a lot of these tests are very uncomfortable to undergo if you have, and they require you sometimes to go off your medications, which then can be even more uncomfortable for you. So what I also hope happens over the course of my career is that we have imaging studies and ways of assessing the GI tract and how it's progressing so that we can better monitor patients and adjust therapies. But either way, if you wait until your GI symptoms become intolerable, it makes it more difficult for any treatment to work, even the treatments that block acid, etc. So really speak up to your doctor if you're noticing any difference and don't blame yourself. It's most likely that your symptoms are related to your scleroderma or even a medication you're taking. So we have a lot of needs that we need to accomplish for research and to improve patient care. One is we need better tests to diagnose GI involvement early on before it becomes very severe. We need sensitive ways to monitor how people are responding to treatments. And then we need to target the root cause of the dysfunction. So, medicines that affect neuropathy, vasculopathy, as well as inflammation, autoimmunity, and dysbiosis, or this imbalance in gut bacteria. And to do this, we need some clinical trials that look at GI disease. And to do this, we need some response measures that companies can use. So when I approach GI disease, again, with this insight, I'm trying to personalize my approach for patients because every one of you is unique. And I've never met one patient with scleroderma or any patient with an autoimmune disease that's identical to another one. And I love horses, so I wanted to show you this picture. But just keep in mind that, if you talk to another patient who you meet at this conference or in your support group or on an online blog, and they share with you what has helped in terms of managing their GI symptoms, keep in mind that that's really specific to that person and what's going on in their life and how the scleroderma affects them and where they live and all these other factors. So if their approach doesn't work for you, don't get discouraged because there's no two patients that are alike. Your journey with your autoimmune disease and with scleroderma is going to be your own journey. So if you're thinking about, how do I figure out how to manage my GI symptoms? Number one, you want to talk to your doctors about the symptoms you're experiencing. You don't need to keep it all inside. Let them know how you're feeling, even if they don't ask you. And really outside of the scleroderma itself, think about medications because there's a lot of medications where they're common side effects are the GI tract. It doesn't mean you have to stop the medication, but you want to speak up to your doctor and say, I started XYZ medication. And since I've started it, I've noticed this symptom or that symptom, and then let them help adjust the medication. Maybe they can lower the dose. Maybe they can advise you on whether to take it with food or not. But there could be a ways without going off the medication to make your life a little bit easier. Diet is something that you have control over. And so that's why I focus on this, because it really is one way to take back, again, control of your health if you start to modify your diet to improve how you feel, and the same with lifestyle. So a simple change to your diet can improve how you feel. And I would say that, doctors who are trained in Western medicine don't get a lot of experience learning about nutrition in medical school, and definitely not during residency or training. And all of the information that I share with you is actually information that I've acquired on my own. So not through any kind of schooling, but it's just through this interest I've had in nutrition since actually I was very young, abnormally young. I became vegetarian when I was 10 or 11 years old, just from reading books. So I think, just know that like you might not be able to get all of this information from your Western doctor, but you can get it from a lot of other places. I just would have caution if you're getting your nutritional advice from social media, because it's hard to tell on social media who really has good background experience and education, because just because someone has thousands of followers doesn't mean they really know what they're talking about. They may just know how to manipulate the Instagram algorithm. So I would just have caution when you're using social media, and, take the information that you receive, but just know that it may not be right for you. And then, the other thing that I find is that when patients start to make simple changes to their diet, not drastic changes, but just simple changes, they start to notice an improvement, and then they realize that they can become an active participant in their journey with this disease. And this changes the psychology somewhat, because I'm sure you can all imagine the day that you were first diagnosed with scleroderma, or your caregiver was, and it can feel like, why did this happen to me? What did I do wrong? But when you start to take back control of your health and start to make changes to simple things like your diet, you become less of a victim of the disease, and you become more empowered, and you realize that you actually do have some control over how you feel, and you can make adjustments every day to improve this. I think step one is starting a food diary, because you may have read about the autoimmune protocol diet and the paleo diet. There's so many different diets out there. It's hard to keep up with all of them. But there's no one diet that works for every patient with scleroderma or every patient with an autoimmune disease. You're the best judge of making the connections between the food you eat and how you feel. And so it may seem very tedious, but the benefits, far outweigh the time it takes to do this. And I think journals are a simple way of keeping track of the food you eat and making these connections. And it's a form of self-care. So I would say it could take about 20 minutes a day to do. And I would just chalk that up to your self-care time. You may not have 20 minutes a day, and then you can skip the journal that day, but usually you have 20 minutes where you can dedicate to yourself each day. And if you struggle with writing, which a lot of patients do who have scleroderma, there are now apps available where you can just simply take pictures of the food that you eat, and it will integrate the information from the picture using AI to then tell you, what nutrition you're getting. So this could be a way to really help with this. And I'm actually working with an engineer now to develop an app specifically for patients with scleroderma that will help them do this food diary and report on their symptoms. I also think it's helpful to kind of make your own diary. So I've done a lot of research on what diaries are out there, and I feel like some of them have a lot of really great features and some have features that I don't really like. But then I took a step back and said, but this is just me. Every patient is different. So really you should be making your own diary. So if you want to kind of do it the old-fashioned way, it might work best where you just get a blank journal, and every page of that journal is an individual day. And I would write down in that journal on the left side of that page everything you eat that day, including the time you ate it. It doesn't be down to the minute, but like if it's in the morning or midday or afternoon or evening, because sometimes certain foods we can tolerate early on in the day, and other times those same foods, if we eat them too late in the day, can cause a lot of problems. So keep track of what you're eating and also the time of day, and then briefly how the food was prepared. Because oftentimes, again, with fruits and vegetables, many patients with scleroderma will have difficulty with raw fruits and vegetables. But if they cook those fruits and vegetables, and you can cook fruit, you can stew berries, there's ways to roast, apples. Sometimes it becomes more digestible and easier to tolerate. So just briefly what you ate, how it was prepared briefly, and then the time of day. And then you're going to hone in on your symptoms that day. And many of you unfortunately experience a lot of symptoms every day. And if you write down every single symptom you experience, this can get really confusing to make these connections. So I think when you start the journey of making a diary that's personalized to you, you want to just pick about 5 symptoms top. It could be less than that, but I wouldn't do more than 5 because, again, it's going to be more complicated. You may have 20 symptoms a day, but all of us can usually identify what are the 5 things that bother us the most. So here are just examples of symptoms that I see in a lot of my patients. And I mentioned, here brain fog and fatigue because these are common symptoms that all patients with autoimmune disease experience. And they're not necessarily GI symptoms. So just know that you don't need to just stick with, diarrhea on this list. If you have brain fog, fatigue, if you have joint pain even, write down the 5 symptoms that bother you the most, because I guarantee that there are ways to adjust your diet to improve those symptoms that you don't even think are connected to your gut. But I see brain fog as a big connection to what you eat in terms of food. So I would keep track of this. And just also notice that, the reason I like the pages is that you can flip back, a little more easily than on the app, although many of you are probably better at apps than I am. But with the pages, you can look back because it could be what you ate the day before is affecting how you felt the next day. So just keep that in mind too, that it's not always the same day. When it comes to different symptoms, I wanted to give you a sort of a gentle approach to how you can adjust what you eat, even on a given day if you're experiencing more heartburn or reflux. So when we think about reflux, this is kind of what we call a heat symptom. So heat rises, and so the acid in your stomach, the contents of your stomach can rise up. And so a very simple approach that you can take, and this comes from traditional Chinese medicine and Ayurveda, is to try to avoid these foods that will promote more heat in your body and embrace more cooling food. So you let the thermal property of the food be your guide. And when I'm talking about hot and cold, I'm not just talking about the temperature of the food, whether it's been cooked or not. I'm really talking about the quality of that specific food. So foods that have heat properties, many patients are familiar with this because right away they'll get reflux if they have spicy foods, peppers, tomato, onions, meat, oily food. But some of you may not be familiar with the foods that can actually be cooling. So cucumber, cool as a cucumber, it's a real thing. It actually is cooling for your system. The same with watermelon, mint, mung beans, even aloe vera juice. And so I try to give my patients suggestions for things that can help them as much as hurt them. Because again, with the psychology of this, if you're making adjustments to your diet and your doctor's saying, do the FODMAP diet, restrict all of this food, it can feel kind of upsetting because maybe you really loved food and you loved eating with your family, and now all you think about is what you can't eat. I like to tell people about the things they can eat that will help them. So again, this is a list of things. You may not be able to tolerate watermelon, so you can skip it. But if it's something you like, if you can add cucumber into your diet, even if it's just putting it in your water to flavor your water, it's a nice thing to do to help improve your reflux symptoms on a given day. Also, pay attention to your evening meal. This is really critical. Um, Animal fats, proteins slow down your digestion. This is because they're more complicated for the body to digest. It takes longer to digest, so it's going to move slower through your system. So, having these foods earlier in the day can be beneficial, and making sure your evening meal is kind of lighter foods like carbohydrates, vegetables, rice, things like this, because you probably won't have as many problems later in the evening. You definitely don't want to eat within 3 hours of laying down. And for some patients, it's even longer. And then you might want to try kind of a cooling herbal tea after dinner. And chamomile is something that's pretty cooling. Green tea is too, but green tea has caffeine, so I wouldn't do it late in the day. And then you always want to sleep on an angle, again, because of that lower esophageal sphincter getting very loose. If you lie flat, this can cause a lot of reflux. And you can do this with a wedge pillow or even adjustable bed. And many times now, my patients are getting their insurance companies to cover adjustable beds for them. So this is an option too. And if you sleep with a partner, oftentimes these adjustable beds now have settings for both partners. So, you may have a partner who snores, for example, and you might improve your sleep if they can adjust their bed in a way that helps reduce their snoring. What about difficulty swallowing? This again can be due to different causes, the esophagus not moving properly. It can be even due to dry mouth, because you can imagine if you're eating something and you don't produce enough saliva, it's actually the food isn't lubricated, so it's hard for it to pass. But regardless of what the cause is, moist foods can be helpful, and dry and rough foods can worsen these symptoms. So, what do I mean by this? So, dry or rough foods, if you don't have enough saliva or your esophagus doesn't contract properly, can get stuck. So, chunks of meat that aren't cut properly, breads, bagels, especially if you don't have that good salivary flow, can get stuck. But even things like crackers and chips, which intuitively you think, well, how would that get stuck? It's so small. But again, it's very dry in quality. So, if you don't have enough saliva to help lubricate even the tiniest little bit of cracker, it can cause that stuck feeling. The moist foods will pass more easily. So pureed vegetables I love, because with pureed vegetables, you can just puree one vegetable, so you don't have to worry about making a complicated dish. And this can pass really nicely. It's easy to absorb. Same with vegetable soups. And I would say that if you avoid heavy dairy or cream in your soup, you'll have a better time with digestion. Even some yogurts can be helpful in this setting in terms of passing more easily. And if you can't tolerate dairy, then I would just say there's a lot of non-dairy yogurts now that are available, made from everything from coconut milk to oat milk, soy milk, and you might want to rotate which one do you try to see what works best for you, as well as stewed fruits. Another thing to keep in mind as well is that when people are, shopping in their grocery market, I realize that a lot of people live in areas where they may not have access to fresh fruits and vegetables all year round, like we very fortunately do in California. And so what I would say is that there's a lot of delivery programs now that have emerged, especially since the pandemic, that are quite affordable, including companies that deliver what's called ugly fruit. I don't know if you've heard of this concept before, but it's actually great. There's a lot of farms that overproduce fruit sometimes and vegetables when they think there might be bad weather, and then there isn't. And then they're left with this surplus that they can't sell to markets. Or they produce an apple and it's not as shiny or as good looking as another apple, but it would taste just the same and have the same nutritional value. This food just gets wasted. And in the United States, about 30 to 40% of food like this just gets thrown away. So these companies now have these systems in place to get this products right from the farmers and deliver it to you. So it's something to think about if your own market doesn't have a lot of fresh fruits and vegetables. You want to chew all of your food carefully. And again, if you have difficulty with your teeth, this can become really challenging. And this is why I like the soups and pureed vegetables, because you could be eating the healthiest of food, like a fruit or vegetable, but if it's not cooked well or prepared well and you have to chew it quite a lot, you might not be able to, and then it will go undigested. So if you're going to pick a fruit, if you're not going to roast it or cook it, you want to make sure it's at least ripe, so it'll be easier for you to digest. And with the swallowing, I would say it's also quite important to eat slowly and mindfully. So if you have the habit of eating on the go, like a lot of us do in the car, watching even television, it's really hard to tune in to swallowing and even being mindful of what you're eating. So I would try to make sure if swallowing is difficult for you, try to eat not doing any other activity so you can really tune in. And you might have to slow the pace of your eating. And it's not uncommon if you live with this disease to eat at a different pace than your family or friends you're out to eat with. And that's okay. You can always, take half your meal to go, or if you're sitting at home eating dinner with your family, you can just have half and save the other half for later. You don't have to keep up with everyone in terms of the pace of eating. And if you need to drink water between, swallowing food, that's okay. You don't want to drink a ton of water and dilute all the food. But if taking a gulp of water helps that food pass, I am all in favor of this. What about constipation? Again, this is another problem that can happen due to different causes. It can due to the small intestinal bacterial overgrowth. It can due to the colon not contracting quick enough. But regardless of the cause, there are certain foods you definitely want to avoid when you're constipated. And these include things like alcohol or any baked goods. And a simple rule of thumb is, I would say, if the food is white, you want to think twice about having it when you're constipated. It's not a universal rule, but if you think about it, things with baking powder are often white. So these are going to be like your refined white food. So bagels, tortilla, breads, pastries. These things will make the constipation a lot worse. Same with drinking alcohol, anything where you've added in sugars. So a lot of food naturally has sugar, and that's usually not problematic. But if you read an ingredient label and it usually separates out the sugars and it'll say added sugars, those are the things you want to avoid, especially if they've added more than 5 grams of sugar. That's going to really disrupt your gut bacterial balance and cause probably more bloating and constipation. There's some foods that can be helpful. Again, this list is different for everyone. So I just picked 5 or 4 things that can be helpful for some patients, but this you might have to figure out for yourself. But generally, some fruits can be helpful. The other thing I would caution you on is that most people who don't have scleroderma, if they get constipated, it's either because they're dehydrated or they don't have enough fiber in their diet. And so if you were to go to your GI doctor, they may say, eat more fiber or take benefiber, but this can really backfire in scleroderma, because if you have too much fiber and your gut is not moving fast enough, the fiber draws in a lot of water and it can actually create blockages. So I would say be gentle with adding fiber to your diet, particularly if you're using like a supplemental fiber like benefiber. It's better kind of to get your fiber more naturally in these foods, and then just pay attention to the quantity, because if you do too much and you have slow motility, it actually might have the opposite effect for you as it would for someone who doesn't have scleroderma. And then I like to recommend a gentle digestive walk after eating. This can stimulate gut motility. I do this for my little baby who can't walk, but I run his legs a little bit, and it really helps with constipation. And so you don't need to do a vigorous walk. It doesn't have to be long. It could even be in your own home where you spend 5 to 10 minutes just sort of walking around. If you eat and immediately lie down, or eat and sit and watch TV, everything kind of gets sluggish. But if you take a little walk, it moves things. But you want to do it immediately after. You don't want to eat, watch TV for a couple of hours and then walk. It won't have the same effect, I find. So try to walk right after eating. Stay well hydrated, because you can get dehydrated and this can cause constipation. And try to tune into your gut, because stress can really affect how your gut functions because of that autonomic nervous system I mentioned. And try to release stress. If you have a lot of stress in your life, which can happen, and it can ebb and flow, and life events can happen, and you can't avoid all stress in your life, but if you have some tools for coping with stress, you might see an improvement in your constipation and even reflux symptoms as well. What about the microbiome? This is something where, a lot of people want to know, well, what can I do if I have these imbalances in my gut microbiome? How do I improve this? And there's some simple solutions I want to offer you today. So the first is to avoid ultra processed foods. The second is you want to incorporate more foods that are naturally rich in probiotics and prebiotics. And then again, start doing more of this self-care to address the mind-gut connection. So let's go through each one. So, what are ultra processed foods? Well, this is a nice figure I found online, and the website is here, which kind of talks about different foods, and some are completely unprocessed. So, if you're eating a vegetable that you're cooking yourself that you bought at the store, it's probably unprocessed. If you go down into your culinary ingredients like your oils, butter, these have been processed a little bit. And then you move down into processed and ultra processed foods. And what defines an ultra processed food is that there's been some manipulation of the food. It's actually not really food, it's food extracts, but there's additives, there's colorants, there's things that have been put into the process of making the food that either change the color, the flavor, the texture, and by and large prolong the shelf life of the food. And what we're finding through research is that these are really detrimental to your health, not just when you have an autoimmune disease, but anyone. And why are they so bad? Well, they can cause what's called leaky gut syndrome. This is where things can actually leak out of your intestines, including the bad bacteria and inflammation. They disrupt the bacterial balance. They lower the overall diversity of species you have in your gut. So you want to have a lot of variety of species in your gut. And if you eat a lot of ultra processed foods, it starts to narrow the number of species that are there. And that can also create problems with your GI tract. And then they can increase inflammation, again, not just in the gut, but because of the leaky gut syndrome, this inflammation leaks out into the bloodstream. It can go to other parts of your body. And we did a study, and again, we presented this last year at our meeting, and we have a paper coming out soon where we found that if a patient had more ultra processed food intake per week, and this is this horizontal line here is the amount of grams per week, and we had some that were eating a lot and some that were eating a little, the more ultra processed foods a patient ate, the more likely they were to have higher GI symptoms. Now, keep in mind, I realize that when patients have a lot of problems with their GI tract, it might be easiest to just eat some crackers that day, and that's okay, but I just wouldn't make the ultra processed foods a part of your diet every single day. If you need to do it to help cope with a symptom, that's fine, but your everyday foods that you're having on a regular basis should not be ultra processed. So that's a really simple change that you can make. And how do you know if an ultra processed food is in your pantry? Well, just look at the ingredient list. And if you see that there's more than 5 to 10 ingredients listed, and some of them are chemical names or red dye this or whatever, then you know that food has been processed. So I wanted to give some options for, what you can eat if you like certain things. I personally love crackers. I've always liked them since I was a kid, but now I'm trying to do more things like seed crackers, where they're just made from, seeds like flaxseed and sesame seed and sunflower seed, and you can make them yourself or buy them. The same with things like kale chips. So you get a little bit of that crunch that's probably very satisfying, but without getting chemicals in your body. Even soda, traditional sodas, especially the diet sodas, have things added to them that we know cause cancer now and a lot of other problems. But I recently discovered some sodas that have prebiotics that are pretty natural. And I'll give you an example of one. If you love bread and you can't live without it, then I would do something like sourdough bread, which naturally has some good bacteria in it. And then, the traditional breakfast cereals are heavily, heavily processed, the ones that you may have grown up eating as a kid. So think about having for breakfast some farro, quinoa, even some oats, depending on what you can tolerate. So this is an example of a seed cracker. Again, they're often a little bit more expensive. So if you can learn to make it yourself, you'll save some money. This is a little prebiotic soba that I sometimes buy, and you can buy it on Amazon for a lot less than in a store usually. But you can see here it has cassava root fiber, Jerusalem artichoke, chicory root inulin. These are all prebiotics. And so you can see if you tolerate it, it has a little bit of carbonation, but what I like about it is it's not a lot of carbonation. So unlike kombucha, which is also has some healthy bacteria in it, I find that for me at least, it's too much carbonation. And if you have a lot of bloating, you don't want to eat too many drinks or drink too many drinks that have a lot of carbonation. And then this is just an example of farro. Actually, in Italy, where my family is from, they have a lot of farro for breakfast, and you can add berries to it or something else to flavor it. I would just say with this picture here, it reminds me that, how you cook your berries in terms of your oatmeal or your farro, whatever you're adding it to. Sometimes people just plop them on top, like in this picture, and have a harder time digesting them. But if you actually stew the blueberries in, you might be able to digest it better. So just, be creative with how you prepare it and tune into how you feel. These are foods that are naturally rich in probiotics, and people always ask me, should I take a supplemental probiotic like a pill? And I always say I'd rather people do the foods because you're getting more of a variety of the probiotics. You're taking it in the way nature designed you to get it. And also you're getting the other health benefits of the food that's there. So if you're having yogurt, you're going to get some calcium. If you're having fermented veggies, you're going to get the vitamins and minerals from those veggies. If you just buy an expensive probiotic, you're just getting the probiotic. And it's not even, really clear whether it's going to go to the right part of your intestines. Whereas when you eat this food, it's going to go to the right places. Prebiotics are these undigestible fibers that the healthy bacteria in your gut feed off of. And here's some examples of prebiotics. And again, some of you may look at this and say, well, I can't tolerate asparagus or mushrooms, and that's okay. You just avoid those, but you look at the list and see, what can I tolerate, and try to incorporate some of that into your diet on a regular basis. And then the last part of the talk, and again, there's so much to cover in this, and I really want to give you all of the information that you need. But it's just supplements, because this is something, again, that often, your Western doctor might not speak with you about. So just be cautious with supplemental vitamins, that there's no evidence that taking too much of a vitamin can improve your health. In fact, if you take too much of a vitamin, it actually can have harmful effects on your body. So if you're using supplemental vitamins, you need to be giving that information to your doctors, just like you would give your medication list to a no doctor, because I think they should be monitoring the levels of those vitamins. But there are some common vitamin deficiencies that we see in patients with scleroderma. This was a review article that we wrote a couple of years ago, where we looked across the literature. So we looked at studies that had been done over many years in patients with scleroderma, and we summarized what vitamin deficiencies were most common. And we've put it together in a figure that shows you where those vitamins are actually absorbed in your GI tract. So for example, vitamin B12 is absorbed in the last part of your small intestine. So you can imagine if you have small intestinal bacterial overgrowth, you could have problems with absorption of all of these vitamins here on the left: zinc, iron, selenium, copper, vitamin C. And I would say that many patients with scleroderma, no one is checking these levels. So if no one is checking these levels, definitely ask your GI doctor, your rheumatologist, your primary care doctor to check the levels of these vitamins. Rather than just spending a lot of money taking tons of vitamins that you might not need, it's much better to figure out what you're deficient in and then take a supplement that's specific to what you're deficient in. So if you're low in zinc and vitamin C, those ones you want to take. And then you want to make sure after a period of 3 to 6 months of taking the supplemental vitamin that someone rechecks the levels to know whether you're responding. If you're not, you might want to switch brands, or if you're taking too much, you can back off on how much you're taking. And then understand when to take your supplements. And there could be a whole full talk on this, but I just wanted to point out some common mistakes that people make. Number one, don't take your supplements at the same time as you take your medications, because a lot of medications and supplements will block the absorption of either one. So for example, if you're taking calcium, you don't want to take an antibiotic. So it's just easier, rather than remembering the whole list of medications you can't take with vitamins, is just separate out the time of day you take them. It doesn't have to be 6 hours apart, but just don't take them at the very same time. Some vitamins are best taken together. So vitamin C goes well with iron, it goes well with zinc, but you want to know what you don't want to take together, and you don't want to combine iron and zinc or calcium, because those compete for absorption. So I recently found a protein shake that I really like for busy days when I don't have time to make something. And then I realized that it had iron, zinc, and calcium. And I thought about writing to the company and being like, why did you put these three? And they don't, they won't be absorbed well for anyone. So just know that there's some nuance to how you can take your vitamins to try to improve how they're absorbed. Because I do find sometimes people get frustrated. They have low zinc and they're taking a zinc supplement and they're like, why isn't this working? But it could be because they're taking it at the same time as their iron every day, and it's blocking the absorption. So to summarize, we have a few minutes left for a question. You can rebalance your gut microbiome when you live with scleroderma by making just sometimes even small changes to your diet and lifestyle, and these can improve how you feel. And I think, by and large, what I want to impress on you today is that you have the power to take back control of your health when you live with scleroderma, and you all showed up for this wonderful meeting. And this is a huge step of, again, taking back this power to gain the knowledge you need to help yourself feel better and be prepared for what may be to come for you in the future. This is just a QR code to, if you're interested, I sent patients a monthly newsletter with information about nutrition, like you've heard here today, that we can't always cover in this short amount of time, and self-care and other things that might just, empower you on your journey with this disease, and all are welcome to sign up. And I'm happy to take any questions from you. And thank you so much for this opportunity.